Good afternoon. My name is Guangdi Wang. I'm with the RCMI Cancer Research Center at Xavier University of Louisiana. I'll try to talk a little bit about the targeted degradation of anaplastic lymphoma kinase, or ALK, for treatment of lung cancer. I have to admit it's going to be a challenge to compress 50 slides into 7 minutes. So it's not really. So anaplastic lymphoma kinase is a receptor tyrosine kinase, first identified in 1994 in the namesake anaplastic large cell lymphoma, and that's how it's named. But it took another 13 years to discover that it's also an oncogenic ALK in non-small cell lung cancer, about 5% of all non-small cell lung cancer. And then it became a target, and inhibitors started to be developed until 2011. The first ever ALK inhibitor, quizartinib, was approved, and it becomes a really established therapeutic target because it benefits tremendously this patient population, prolonging the survival of ALK positive small cell lung cancer. But resistance soon develops within a year, largely due to on-target mutations, because the mutation on the kinase binding domain would render the inhibitor less effective, couldn't bind effectively. And so we spent the next 10 years developing second generation and third generation ALK inhibitors like ceritinib, alectinib. These are all approved by FDA. So there's a total of 5. But the problem persists, the resistance due to multiple on-target mutations would make all the existing inhibitors useless and less effective. So instead of inhibition, we propose a different approach. Rather than inhibition where you put the ALK inhibitor in and try to block the signaling, but on-target mutation that makes the binding less effective because it changes the shape of the binding domain, and therefore are reactivating the ALK and leading to the relapse of the disease. Here we want to do a degradation of the protein. So we design a molecule that binds to the ALK active site, binds to an E3 ligase, and induce ubiquitination of the target protein, and leading to the proteasomal degradation of the ALK target protein. So by doing that, we are really trying to get rid of the protein to begin with, so that there is no chance of the protein to develop on-target mutation because the proteins no longer exist, and overcome the resistance. So we tested it in clinically relevant cancer models. In non-small cell lung cancer, we see that the ALK inhibitor, it's decreases the phosphorylated active form of the ALK, but not the total level, whereas the degrader decreased the total ALK level and thereby eliminating the phosphorylated form. And that the same is observed in another anaplastic large cell lymphoma cells. Basically, it becomes more effective. And that's translated to the cell proliferation assays where the degrader is found to be more potent than, in this case, a third generation inhibitor, lorlatinib. That the same goes with the ALK-dependent anaplastic large cell lymphoma, where the ALK degrader is more potent than the third generation lorlatinib. So if we take the drug then into an in vivo system, where we grow the non-small cell lung cancer or the ALCL cells into xenograft tumor, subcutaneous, and we treat the mice with either an inhibitor or a ALK degrader at different doses. We found that in non-small cell lung cancer tumor model, the ALK degrader was more efficacious in inducing tumor regression at an earlier time and at a lower dose. In the Corpus 299 xenograft, which is the ALCO model, we see the same thing. The ALK degrader is more effective in regressing the tumor. Importantly, the degrader, even though it's a much larger molecule, it was already bioavailable, designed in such a way that it is permeable. And so the degrader at 10 milligram, 25 milligram afforded excellent systemic drug exposure, judging by the plasma concentration after 3 weeks treatment. So with that, we conclude that the ALK degrader has great potency inhibiting ALK activity, and therefore the ALK dependent cancer cell growth in vitro and in vivo. The degrader is orally bioavailable, therefore can be designed into an oral drug. And the degradation can certainly overcome resistance to ALK inhibition by its mechanism of action. And therefore, we think the degrader should be tested. Right? With that, I'll happy to answer any questions.
Out of curiosity, how does your approach compare to some of the other PROTACs out there, and what is your freedom to operate from an intellectual property standpoint?
So the provisional is already filed. This was based on an empirical approach, as everybody's still doing. You basically need to have a linker and the E3 ligand to be amenable to oral bioavailability. So but we think we found it. It's very similar to what those the disclosed structures that have been are being tested in the clinic, like the Avinas compounds and the Nurix compounds. Very, very similar in terms of the composition of the linker, that it avoids all these hydrophobic and lengthy, this approach, rather using like rigid and heterocyclic approach. So the CRBN ligand, like thalidomide, lenalidomide, these are all very orally bioavailable. So that's not a problem. And then the warhead of the binding moiety is based largely on existing inhibitors. You change it so that it can overcome those point mutations. So you can use different, but those are already oral drugs. So really the key is to, the linker moiety and the overall that retains the polarity and the compactness. So it's possible, yeah. Yeah, so you have to optimize the lengths. How
important is the length of the linker?
Right, so you have to optimize. It is important. If you don't want to be 1 inch longer than necessary, is what it is. Yeah, so you have to kind of go all the way from short to long, giving one composition and test it out. And then you have to change a different type to test this. First, you search for activity, and then if you get the data, you immediately test it for oral bioavailability.
I have a quick question.
Oh, yes.
You mentioned that a lot of this work is done through classical empirical chemistry. What are you seeing on the in silico side for kind of protein degradation from the chemistry side?
It's kind of an It initially is helpful in a way that where you design the linker site, because you have to know that the moiety of the warhead that binds to the target protein, it has you have to link it to a point that is towards the solvent exposed end and not the deep pocket. So that it's helpful, but after that, it's all like really an after. Thanks.